Good morning. My name is Jeff Zayach, and I'm the Public Health Director with Boulder County Public Health. Thank you for joining us this morning. I'm joined here today with my medical officer, Dr. Chris Urbina, with our two school superintendents, so for St. Vrain Valley School District, Dr. Don Haddad, Dr. Rob Anderson with Boulder Valley School District, as well as a couple folks from my staff, Lisa Whittakin, who's our Communicable Disease and Emergency Management Manager, as well as Carol Helwig, who's our epidemiologist. We appreciate people taking time today to listen in on this. As you've likely heard, yesterday we were notified by our partners at Tri-County Health Department that a person had tested positive for COVID-19, spent time in Boulder County while they were ill. We're conducting a thorough disease investigation and are working closely with our partners at CU, who have been long-term great partners with us. Given this change, the fact that we've seen such a large and rapid increase in positive COVID-19 tests in Colorado, and an increase in positive tests in the Denver metro region, the capacity concerns that we're beginning to hear from our providers' offices and our healthcare systems, and that we believe that the virus is already circulating in our community are reasons we've made this decision to begin implementing our community mitigation measures. This means that all of us together must actively take steps to protect each other from further spreading the virus. We must all commit to, most importantly, staying at home when you're sick. That is the #1 way to prevent the spread of this disease. Staying more than 6 feet away from each other. Do not attend large gatherings. Regularly washing our hands with soap and water for at least 20 seconds. Coughing and sneezing into our arm or a tissue, or washing our hands using an alcohol-based solution. Not touching our face. I was amazed to hear that we, on average, touch our faces up to 90 times a day. So think about that. That's a lot. We want to make sure that we're focusing on making sure our hands are clean, we're not touching our face, and we are doing what we can to prevent the spread of this disease. We also want to focus on making sure we're cleaning frequently touched items like doorknobs and keyboards. As we know from the Centers for Disease Control guidance, as the virus spreads, we need to further reduce our actions in order to slow the spread of this virus. We need to protect our most vulnerable and to make sure our healthcare systems do not get overwhelmed. On a community level, it's critical that we take prevention measures like community social distancing. One of the steps is to temporarily close schools. Last night, in partnership with St. Vrain and Boulder Valley School Districts, I made a strong recommendation, and we together decided that we would close schools for at least 2 weeks. One of those weeks is spring break. Together, I will work with the school districts to continue to watch the virus spread in the community as we near the end of that period, and we will make decisions together as to whether we will reopen the schools. Although early data suggests that children are only affected mildly by COVID-19, they play a significant role in the transmission of this disease. In addition, Centers for Disease Control suggests that closing schools and large gatherings early in a community's transmission can have a significant impact in reducing the spread and number of cases with this disease. Dr. Chris Urbina, our medical officer, will be able to answer more questions about how this strategy works. But before I turn it over to him, I'd like to offer either of our superintendents to make any comments at this point, Don or Rob.
Thanks, Jeff. I just wanted to take this opportunity to compliment and thank Boulder County Public Health. They've been incredible partners for both Don and I, St. Vrain and Boulder Valley Schools. In the face of a crisis, it's critical that you have accurate and clear information and communication, and we got just that from Boulder Public Health, so we really appreciate that, and just wanted to take this opportunity to thank them for that.
Yes, I would like to also thank Boulder County Health for their strong partnership, and I'd like to thank our entire community for their support, our teachers, our students, our staff. Got a lot of really dedicated people working on this, and our top priority is to promote the safety and well-being of all of our community. So thank you, and we'd be glad to answer any questions that you might have. Thanks.
I also want to do one more thank you. I want to thank our healthcare partners in our communities. This virus, as we can all see in the media, has significant impacts and is changing very quickly. And many, many partners, many people in our communities are reacting very quickly and doing a lot of work for a lot of hours to try to contain the spread of this virus. So I want to thank all of our healthcare partners. I want to thank all of the staff across local public health agencies and the state health agency for reacting very quickly to try to control the spread of the disease. And at this point, I am happy and to introduce Chris Urbina, who is our Chief Medical Officer. Chris?
I'd also like to emphasize that we have a very strong team in Boulder County Public Health, and working with our partners, I think we are going to have a challenge ahead of us, but I do think we're putting together mitigation steps that can make a difference. So I'm here to basically answer your questions along with our superintendents and Jeff. So do you want to open it up now to questions, and then we'll take turns on who is the best person to answer that question?
Any questions online?
Any questions on the phone?
Or in the room? Do you have any idea, I know the investigation is preliminary, do you have any idea how many people
You ready for my question?
may have had contact with? One.
Sorry, one moment. All contagious.
So I'm going to repeat the question. The question was, do we know how many people who have been in contact with this person that Jeff, that our public health director mentioned earlier? At this point, our epi team and our staff are out there investigating, and that's part of our process, to discover where they were, where they worked, and to identify those people that had close contact. Obviously, people walking in the hallways when they were working or would be low risk, but people that had close contact with less than that 6 feet in the healthcare facility or in that setting where they were working, those are the folks that we're talking to.
Charlie, Brennan, do you want to go?
Yes. Many of the closures that we're hearing are all couched in a time frame of 2 weeks, near a several week period. Can you talk about our confidence in any kind of belief that the virus situation is alleviated, mitigated, that we sort of flatten the curve, so to speak, in 2 weeks, 4 weeks? What kind of confidence can we have around the timeline? And if people can identify themselves before they're speaking, for those of us on the phone, that would be a tremendous benefit.
This is Jeff Zayach, the Public Health Director with Boulder County Public Health. And I believe the question was, what is the confidence that we have that the virus will reduce, will stop spreading quickly within the next 2 weeks? And we don't know that for sure. This virus is new. The only thing we do know is what we've seen happen in other areas. We know that taking actions like this, like mitigating the disease spread by closing schools, by canceling large events, helps reduce the spread of that disease. So what we will do as a community is we'll continue to watch, not only our community, but we'll continue to watch communities in Colorado, watch the testing results, and then make decisions based on that. Our hope is that the disease would not continue to spread actively for more than the next week, but we know that's probably not realistic. So we will continue to watch that disease closely and make decisions based on that.
Hi again, Chris Urbina. I'd like to add to Jeff's very strong points. Our challenge is, as you see on the national media, you see that this epi curve that they talk about, right? The huge increase in cases, and that's happened all over the world. Very rapid increase with testing, and then that rapid, hopefully, decrease over a period of time. These social distancing as well mitigation activities that we're doing in Boulder County are an attempt to reduce that rapid rise. So we're trying to flatten the curve, essentially. And so by identifying these cases through case investigation, again, my name is Chris Urbina, for those folks on the phone, sorry about that, I forgot to introduce myself. To try to flatten that curve, identify those cases, and stop the spread. Because we have tools like isolation, if you were infected, that we can social isolate you at home, or we can put you in a health facility that will keep you distance away. But the majority of cases, our contacts are folks that are saying, if you've been exposed to these clients, we're going to recommend that you stay at home. to have quarantine, essentially for 14 days. As you know, and all of you have seen in the media, the incubation period of this infection is from 2 to 14 days. So our idea is for those 14 days, maximum 14 days, that if they don't have those symptoms that are common with coronavirus, that is shortness of breath, fever, and cough, that they're going to probably be okay and they don't have the disease. Other questions?
Hi, yes, this is Matt Bloom with KUNC Public Radio. Can you hear me?
Yes.
Hi,
Sorry, you're good. You can continue your question.
oh, I'm sorry, I can hear someone in the background, so I wasn't sure. For broadcast purposes, can whoever's typing on a keyboard, whether it's on the phone or in the room, please move your computer away from the phone? We can't use any of the tape. I'm so sorry to be difficult. But Mr. Zayach, could you just reiterate what guidance you're giving people about attending large gatherings? Is it everybody or only people above a certain age? Can you just reiterate your recommendations for residents?
Yes, we have recommended to all of our large event planners that they strongly consider canceling events at this point. We know that if we bring people together in close proximity and large numbers, that we increase the chance that we are going to have more community spread occur. So our recommendations have been to close large events, and then the same recommendations that I'm sure many of you have seen in the press around social distancing, making sure that we are finding ways to do things by not having to sit in the same rooms together, are going to help us reduce the spread of that virus. And I'm sorry, my name is Jeff Zayach. Yes.
Hi, Chris Urbina. I want to add to Jeff's comments. The issue is that the most vulnerable populations, particularly those folks over the age of 60, people with chronic medical conditions, and that includes children and infants as well, that those folks are the most vulnerable. Currently, we know that only 80%, roughly 80% of all cases of coronavirus or COVID-19 are mild cases. But those vulnerable populations, we're trying to prevent them from coming in contact. So these social mitigation issues, social distancing, exposure to the virus is our way of stopping that spread as much as we can and not infecting those folks that are most vulnerable.
Chris, we have a question from Facebook, if you wouldn't mind answering.
Sure.
What do people do when they're coming home from spring break?
Again, my name is Chris Urbina. Hopefully they had a good time at spring break. That's important. It depends. I would hope that they are well. And I think what we're concerned about is if they've been exposed to folks that are potentially ill. In this case, whether or not it's influenza or other infections, or influenza is still circulating in our community, that they should have gotten the flu shot before they left. But if they didn't, and they developed these symptoms, i.e. cough, shortness of breath, and fever, and they may have been exposed to a large gathering where there may have been other people that are sick, or to an area that may have large numbers of infections in that area, they should consider maybe social distancing. And at this point, it's hard to know whether or not they should be quarantined or not, but at this point, they should use our guidelines in terms of maintaining social distancing. As we hear more from the schools and our community, we'll probably be pushing out more recommendations on how to protect them individually as well as their families.
We are getting a lot of questions in regards to parents that, obviously now that school's out, they've got, kids and they're trying to figure out what to do with them. So they're asking about, is it okay to have them play in the neighborhood or, that kind of thing. What kind of advice would you give to them?
Do either one of the superintendents want to talk about it, or would you like me to address that?
Well, I think you can address it from the health perspective.
Sure, okay.
And then I'd be more than happy to answer any questions related to the school perspective.
So again, this is Chris Urbina. I'm the medical officer here in Boulder County Public Health. The question was, what do we tell folks in terms of this now that the schools are closed? Well, what recommendations that we should have for those children and their families? It is the same. So we should all be practicing good hand washing techniques. Not touching your face, eyes, or nose, and you notice I have not done that throughout this entire talk. Washing down surfaces with appropriate cleaning solutions. I think we just have some wipes here. We can show that as a prop if we want to. But I think the idea is to reduce your contact with other people, thank you, reduce your contact with other people so that you can apply these same social distancing activities that would reduce your chance of coming in contact with an infection. And if you develop sickness, then I, again, stay at home, not go to large play areas, and depending on whether or not the schools are open or not, if they are open, then I would assume that the schools might restrict their activities if they're sick after they come back from spring break.
Thank you.
Jeff, we have another question from Facebook. Can you speak about how children will be getting food while school is out?
Yes, we are extremely fortunate in Boulder County to have a great wraparound support system here, which helps provide those kinds of things in times of need. We have our community services and our housing and human services departments, as well as incredible support from our family resource centers in our community. And I know the schools as well have been thinking about how to help support kids when something like this happens. So I think we have a robust system in place right now. We've operationalized that system, and we have folks sitting down and thinking about how to make sure that we are providing those things. I would offer any other comments from either of the superintendents on this.
Yes, in regards to providing support with nutrition services for our students, we have been in planning, and we have a plan in place to where we will continue to provide opportunities for students to access food. We have sites that have been referenced, and we will communicate with our parents and have continued to communicate with our parents, letting them know where they can access this support, and also would welcome at any point in time for anybody to contact me or anybody on our team, and we would be glad to give you additional information, but that's a high priority for us to continue to provide nutrition support for our children and many other support systems as well. So thank you.
So as we made this decision, I would say that this is one of our biggest worries, right? That we wanted to make sure that we're supporting all of our families, those with food insecurities. And so our team is hard at work, similar to St. Vrain, in developing a plan on how we would be able to do that and distribute food. We should be have the results and the more information on that plan by Monday, and we'll have that posted up on our website. We'll begin reaching out to communities on how they can access food, and that we can come together truly as a community to make sure that we're supporting those that are most vulnerable.
I had a question for Jeff or Chris. I'm wondering if one of you could address just, your ability to sort of bird dog where COVID-19 has been in the community. How do you do that when you don't have access to a lot of test kits?
Hi, Chris Urbina, the medical officer again. That's a great question. It's a question that we are handling poorly across the entire country. And this is a dilemma. If you look at other states and you watch the national news, the testing just simply is not available. So we're right now with our partners in our health systems, our partners in our community, we're looking at setting up testing. As those kits are available, as we have appropriate PPE and we have protocols, we're going to be testing more, I would say, in the next 1 to 2 weeks. Now that's our dilemma. Without testing kits, without adequate personal protective equipment for our healthcare providers, we're going to have a challenge here in standing up these testing. So you're going to hear more from us here in Boulder County as well as the state as we stand up these testing. So they currently, as you know, they have the drive-through testing at the state laboratory. Some of the commercial laboratories, including LabCorp and Quest, are exploring the possibilities, but this is a work in progress. I think Jeff said it nicely early on. This is an evolving disease process, and so as we learn more about the infection, as we learn more about the resources, we'll be sharing more information. And I think we want to refer people who have questions to the Colorado Helpline so that people can answer their questions. Go to a reputable source, CDC or the Colorado Helpline, to actually get your questions. That's very important that people have accurate information because often you make decisions based on, unfortunately, fear. We want you to make those decisions based on fact, and that's why we're having this Facebook Lab.
Hold on, Grace.
Has Boulder County Health run at this point?
Did you hear the question?
We're testing now because there are multiple people testing in our community. I don't have the exact number, but it's not a significant number. So as those testing gets ramped up, we'll have more testing available and we'll have more results.
When can we expect that testing to be ramped up?
As I said, Chris Urbina here again still. I expect that we're going to be ramping that up over the next 1 to 2 weeks. Now, exact date, I can't tell you.
Is the testing then going to become more proactive, or is it going to be limited to those who have had contact or exposure with others who have been exposed to it?
That's an excellent question. So the question is, is the testing going to be ramped up for everybody, or is it going to be just for those folks that may be at higher risk? I think that's what I heard you ask.
Yes.
So the idea is, because the testing is limited right now, we're prioritizing those contact investigations that we talked about earlier. So those folks that may have been exposed to a COVID-19 case, we're going to prioritize those folks for those testing. There are also specific criteria that the state lab is also recommending. And those are folks, and I can go through that detailed list if you'd like, but basically those are folks that are ill, that have severe symptoms, that don't have another explained reason to have those illnesses, and they've been exposed to a COVID-19 patient, or they traveled to those countries that we talked about. Or they've been exposed in some other setting and have those symptoms. So those are going to be our priority folks. And of all the questions I hear most often in the community, it's, I'm concerned, can I get the test? And those folks probably aren't going to be able to get the test right away. We're going to prioritize those testing for those folks that we think are at greatest risk.
Do you have enough tests even for those who've been identified as being in contact?
We don't, but we will hopefully over the next 1 to 2 weeks have more testing available.
Chris, we have a question from Facebook. Can you talk about when an employee is confirmed positive for COVID-19, what sort of communication should the employer be communicating to the rest of the staff?
That's a great question. The question is, if an employee becomes sick with COVID-19, I assume that it's confirmed?
Yes.
Okay. What kind of information should the business or employer say to the rest of their staff?
Right.
So hopefully, many of the businesses and agencies are already out there upstaging their communication strategies. They hopefully have listened to Boulder County Public Health to stand up how they can protect themselves in their community setting. So they hopefully have done that already. Now, so that people not knowing that they had a positive are protecting themselves already. So there is something called a continuity of operations plan. And I think Lisa can talk about this if we need more specifics about that. But every business and employer should have that continuity of operations plan in step, which will include how they communicate with the other employees, how that person is going to be protected or supported as they go home, hopefully, because they don't want other people to be infected by this virus, so that possibly they could be in isolation if they have mild symptoms at home, maybe work from home, maybe still contribute, and they're also protected from an employer-based basis on benefits and other things, and similar to what the schools are doing in terms of the food security. We don't want the employees to just be sent home and not have any access to resources. I know we're working very closely with our community partners to step up some of those background and support for employees that may be sick, that may have this virus and not be able to work.
Just a reminder to anyone that's on the phone, if you are not speaking or asking a question, please mute your phone. Thank you.
Do we have any more questions?
Question, Charlie Brennan, Daily Camera. In our area, we have one library that is announced its closing. We have other libraries that have not. What would the guidance be for a public library specifically at this time?
Hi, thank you for that question. Jeff Zayach, Boulder County Public Health. The question was, as I heard it, we have some libraries that are closing in some areas, others that are not. What would be the guidance for that? And we've been working really closely. We have a group of all of our city administrators that meet together weekly. And the guidance that we are providing right now is that they should follow the social isolation guidance, which is to make sure that if they're going to continue to provide those services, that they do the best they can to make sure there's adequate messaging and that there's adequate graphics to demonstrate that if somebody's sick, they really shouldn't be entering those facilities. We do not and have not required closure for those kind of facilities, but we are working really closely with them. So as an example, if somebody else closes a library, we fully support that from a public health standpoint, because we know that if a local community chooses to make that kind of choice, it is likely going to reduce the spread of the disease. But we are working closely with all of our municipalities to talk together about how we want to approach that. We have weekly meetings so we can get to all of our municipalities together and we can make those decisions jointly.
We had a question about panic buying. Do you have any guidance for how much people really need to be buying things in advance?
Yes, this is, it's been clear. We've seen what's happening in the media with the panic buying. And our message to people are not to panic. We don't want people to panic. We do want people to prepare. But when we panic, we obviously deplete resources that other people need as well. So we want to make sure that that message gets out. It's important for us to keep thinking about doing the social distancing, but we don't need to panic. We don't need to go into a panic mode. I appreciate all the support that our different agencies are providing, and we want to reassure people that if you follow the social distancing measures, if you think about yourself and how you potentially can reduce that exposure, there is no need to panic. We will get through this, we will move forward, and we will get past this virus spread point, and things will start to normalize again, and we don't want to drive panic in the midst of it.
If the closures extend, this is a question for the superintendents. If the closures extend past spring break, what will that mean for students who are taking the PSAT, SAT, AP, and IB tests as well? Are there any plans in place at either of the districts for that?
Thanks, Henry. That's a great question. I think that we're going to have to wait for guidance from the College Board. What we're facing here in Boulder, Colorado is it's happening all across our country, and I would have to say that as students are impacted as they're taking these tests or preparing for these tests, that there is going to have to be some accommodations that are made. At this point, I just don't know what those are.
Are there any additional questions on the phone?
Any questions from the phone?
Okay.
Want to close it?
Chris is going to close. You going to close it?
No, I think Jeff should close. How about if we each make closing remarks?
Yeah.
That would be great. So Jeff Zayach, again, Boulder County Public Health. I just want to thank everybody again. I really appreciate the press. Getting these messages out are really important in a time when there's a whole bunch of information and it's difficult to make decisions. So I want to thank all of our press partners. I want to thank everybody that's taken the time to be on this event today. We want to continue to get this information out, and this is a great way to make sure that we're getting consistent information out to a large group of people. Again, don't panic in this situation. Think about yourself and how you could potentially help prevent the spread of this disease, and keep following the guidance. There's guidance on our website at Boulder County Public Health. And we would want you to continue to just think about that and make sure that you're washing your hands, coughing into your shoulder if you have to cough, and then not attending large gatherings. That's one of the biggest things, as well as staying home when you're sick. That is a message that we continue to drive with all of our businesses, with our own employees, and with everybody that we talk with. Please stay home when you're sick. And that's it. I want to thank you all, and I'll turn it over to Dr. Chris Urbina.
Chris Urbina here, and I wanted to know if the superintendents wanted to make any closing remarks as well?
Sure.
Okay, good. Why don't you go first?
This is Don Haddad, Superintendent for the St. Vrain Valley Schools, and I want to reiterate my sincere appreciation for all of the support that we've received, both within and among all of our employees within St. Vrain, but also throughout our community. I recall back in 2009 in that area when we went through the H1N1 situation, and then again there were situations with the SARS, and then we had at one of our high schools a pretty significant outbreak of tuberculosis many years ago. And then we had the flood in 2013. And my point for raising all of these points is that we have an extensive plan that has been developed in the St. Vrain Valley schools. It has been in place for many years. We review it regularly and update it each and every year. We go through these things to make sure that the names are current, the processes are current, and we have paid close attention, one, to the safety and health and well-being of our students, our teachers, our staff, and our community. That's always our top priority. We have systems in place that continue with payroll for people who are concerned and question about that. We have systems in place through our Human Resources Department. We have systems in place with our Technology Department. We have systems in place with our Operations and Maintenance Department. We have systems in place for our learning services that will enable us to extend learning. One of the nice things about the St. Vrain Valley schools is we've had a one-to-one, really powerful technology system in place for many years with lots of capacity. So we will be able to continue education for our children as it's needed, and we are communicating extensively with all our families around these types of services that we will continue to provide. I want you to know that we take great care in striking a balance. We know that safety is our top priority, and we also know that when students are not in school, that presents a whole host of additional challenges. So we will continue to work closely with our partners in Boulder County in order to make the most sound decisions that we can make. The decisions are never made in isolation. This most recent decision came after a strong recommendation from Boulder County Health that we close our schools, and we are going to continue to work closely with them to get updated information. I would invite everyone in our community to access our website for routine updates, to check your emails, your voicemails, your text messaging. We'll be communicating through all of those venues. And then also, please feel free to call at any time. We're available 24/7 to respond to your phone calls. We'll do the best we can. The one thing that I would say in situations like this, everyone's threshold around what to do with these types of things, and everybody's perspective differs. And so we have competing opinions, and I welcome those competing opinions and will respond to them as best we can. But please know that every decision that we make is not a decision made unilaterally. It's not a decision made off the cuff. It's a decision made with a lot of information, a lot of factual information, a lot of science, a lot of information from all of our stakeholders. And so I want to thank you again for everything. And I also want to really thank our team in St. Vrain. I have watched them 24/7 working on all of these things because they care deeply about our children and our community. So thank you very much for all of your continued support. Thank you.
Rob Anderson, Superintendent, Boulder Valley Schools. I'd also like to thank the team in Boulder Valley Public Schools for all that they've done to prepare us for this point. Work has been going on for weeks since we first started to see this virus hit our country, and been working tirelessly to make sure that we're prepared and ready to go for where we're at today. We will continue to communicate. We've been communicating constantly with our parents and community members. We'll continue to do that as we have more information on our food distribution plan, as we develop our home learning plan and get more information out there. We'd like to remind our families that our schools are open today, and I believe the same is in St. Vrain as well for folks who didn't have an opportunity to grab their things and didn't have any sense that yesterday was going to be the last day of school for them for a while. So we do have administrators at all of our schools, and so we're available. Come in, pick up your things. We're going to ask that you not stay long. We're doing everything we can to make sure that we're honoring the social distancing that we're trying to attain through this measure. and our custodial team, who will be hard at work making sure that they're disinfecting our buildings, and so when we are ready to come back to school, things will be clean and ready to go for our kids. And just want to share with all of our parents and kids, hang in there. I know that this can be a scary time. We're all working together. It takes strong partnerships, like the partnership you've seen here today, to make sure that we're giving accurate information, clear information, and we will be communicating with you honestly and often on what's happening and where we are. We hope to be back in school as soon as possible, but again, we're going to be working with Boulder Public Health to make sure that we're not going to do that until it's safe for kids. So again, thanks to everybody for all that you're doing, and just really looking forward to watching our community come together in the midst of this crisis.
Hi, Chris Urbina. I'm the medical officer again here at Boulder County Public Health. I also want to thank my colleagues and our communities. We're working very hard, maybe not 24/7, but pretty close to that, to try to bring together folks to understand the importance of social distancing and our mitigation procedures. It's often confusing when you have a federal government, state government, and local government all trying to work together, all trying to bring the same resources together to mitigate this. Rest assured that our team is working very hard to make a difference in terms of this. And this activity is a part of that message. Get accurate information. There are things that you can do at home personally. There are things that you can do for your family. There are things that you can do in your work environment that can make a difference. And I think you know what those are already, but I'll repeat them again. Washing your hands with soap and water. If you don't have soap and water, use alcohol-based wipe. Not touch your face, eyes, or nose, because that's commonly how we get this infection, or any other infection for that matter. You rely heavily on social distancing. Step away from people at least 6 feet. Use the elbow bump when you can. Reduce the amount of shaking hands, those kinds of things, because that does transmit virus. Washing down surfaces with cleaning systems that are approved. And I know the schools will be doing that very aggressively soon after they close the schools. And if you're sick, stay at home. So I think that's our final message. I do think that we can bend that curve a little bit, but we're all responsible for that. I know Jeff has some final closing comments. Thank you very much.
My final closing comment is just to thank very much our partners in the school district. As you heard Don and Rob talk about, we would not be able to move forward unless we were doing this together, and that helps all of us. And we've had partnerships in place for many, many, many years, and it's because of those partnerships that we're able to make these kind of decisions and to move forward in a way that's as consistent as possible. So I want to thank you both for being here today, and that's all we have. Thank you.
This is Chana, the communication manager here at Public Health. I just want to let people know on Facebook that we will do our best to answer all of your questions. We'll work on that today and get back to you. Thanks everyone for being here.